Mhm. Hello, dear colleagues. How are you? I hope everybody is okay. It's 7:13 p.m. in Almaty, Kazakhstan. It's a Central Asian country. My name is Mynzhylky Berdikhojayev, and we have a patient number 5 for today, but live streaming number 4. The previous patient we diagnosed possible CC fistula, but diagnostic angiography showed everything is clear. And now we have a patient with the Callosal AVM. He was treated 2 times before, and the first session was done during the Neradik course in Astana. And on the session number 1 we used Aptura with coils. I think this territory was used coil and sonic, and if you can see on the left side everything is clear and Aptura is cleared, and now you can see only the cast created with the squid and Menox, maybe, mostly squid 12. And the first session was through the left pericallosal artery. Second session we have done through the right pericallosal and the right PCA territory. And on control angio yesterday, after last session, patient had a bleeding intraventricular, and this part is remaining part of the AVM, and you can see there is a tiny vein going down and another 2 veins going up. Remaining part, and we discussed with the family and the patient about the possible treatment options. Last time we couldn't get to this tiny branch from pericallosal, and it was looked like another couple of branches coming from the anterior cerebellar artery on the right side. Yesterday we did a diagnostic angiography and we couldn't find any significant branches from the vertebral artery territory. Everything were clear, and the main supply from the only supply from the right ACA territory. And now we have this tiny draining vein, and with possible venous approach. There are 1 vein and 2nd vein, and also the deep venous drainage. Let's see what we can do. These 3 veins, 1, 2, 3. Yes, we discussed possible treatment options with the family, and they said they are not ready for the gamma knife, and now we are planning to do the next session. Okay. We prepared Fubuki 7, and I think for this venous approach might be sonic is okay. But this part is not so clear. That's why let's go from the artery, then we can super selectively clarify the situation, and then we may attack from one of the branches. is I want to take a Scepter mini balloon with this sonic 1.2. I think sonic 1.2 should be okay. Так, на реке наш ширмс. Оникс на шприцар наш солнце. I will take sonic 1.2. Yes, Okay, let's start. It's a long day, yeah? But I slept well in the morning, and now it's just 9 hours from the beginning, and some update on patient with migraine. Yesterday we treated left side, and finally on the patient with the migraine at the end we decided to place one coil in the meningeal artery after lidocaine injection, and left the right side, and it was a slight pain till the evening, and then at the evening the headache is completely gone, and in the morning okay, we have option number 1 and option number 2. Так, мына жер обработка істеп қойдыңдар ғой, да? Is it necessary to go transvenously? Okay, let's check again the venous side. Yes, the cortical veins so tortuous, but the deep venous drainage we should find this vein. I'm not sure it will be easy. But maybe super selectively we can find it. Maybe super selectively we can find it. Okay. Let's start from the arterial, then if it's necessary we go. Пока мынау тұра тұрсын. Артериядан кіріп көрейік, егер ыңғайлы болатын болса артериядан бітіре саламыз. Yes, let's see the artery. If the venous part will be clear, then we will go through the vein. Okay, we opened the Scepter mini. Now in the department we have 3 pieces of Scepter mini. It's a nice tool, but a little bit specific. I think we can place this one. И не бересиш трехходовый краник. We need a 3-way stopcock. И не наш пересосиш шприц. Yes, there is a specific of preparation of the Scepter mini. We take 100% contrast. It's 100% contrast. Yes, 100%. Then we connect it to the set termini. And now we will take a balloon and we'll direct it up. It's like all double lumen balloons preparation. And now we will start to inject the pure contrast. It's a 100% contrast. Okay, I need to close it. It's flashing and it's nothing visible. Yes, usually it's quite hard to do balloon dilatation. No, now it's dilated. You can see balloon is ready. Balloon is inflated, but it's not yet ready. And then I will put it in the contrast and start to deflate it. Okay, let's see. It's a long inflation and long deflation. As inflation may be faster, but deflation is longer because of the pure contrast. Okay, now I think it's deflated. It's not already deflated, and now deflated. Okay. Okay, balloon is ready. We used the scepter mini several times, and the last scepter mini was used during the link course live stream to Paris, and it was successful treatment of the occipital AVM, and the part of the treatment was scepter balloon. And yes, it's quite effective, and fortunately at the time of treatment it was no reflux behind the scepter mini, and we could complete the treatment. And now we took a Chikai 8 for the scepter mini navigation, and also we will take a Sonic 1.2 by 25 to navigate in the ACA territory. We will try to go with the mini to this small branch from the Callosal, if it's possible. Usually it's a U-turn and not all the time possible to go directly. Okay, mini is ready. We'll put it through the straight Y connector. Aldık. Okay, access is 8 French sheaths short, then Judkins right 8 French Judkins right 40 with the tip modification by hand. Сетпсен мыды? Саусақпен бұрдың басын? Yeah. He did, yes. Тағы бір тройка шпиц. Маған не жинай салу керек? Дымысу. Ромырыш. И тағы бір набор шпиц аштыра салыңыз. Так, бағанағындай неден жаңасын қиясыз ғой, да? Okay. Okay, let's prepare the Sonic. Sonic now 1.225. It's an old version with the hybrid in the package. Unfortunately, we have no other hybrids, and we finished all hybrid 7 today. We will ask the distributing company to bring more hybrids, because all Sonic, not all Sonic, the half of the Sonic in department without hybrid in the box. We need to adapt for new situation. Then possible to order Traxxas 7. It will be a bit expensive, 2 or 3 times than regular hybrid. But we can take an opportunity to work with the different devices, thanks to Bolt company. The problems usually bring the new opportunities. I'm looking for the problems usually like a way to bring something new in my practice. It's good. The problem with Spider was in 2020-21, and then we completely shifted to Pronder. And nowadays we nearly stopped to use the Spider, and we shift for Pronder. The same was with several other type of materials, and finally we are happy with the new possibilities and new materials. Yes, I think in the family it also looks like this. If you are absent in the family, then family may replace you. It's not good. Okay. Okay. Now we are in the MC territory, in IC, and should place Sonic also. Yes, Sonic is in the IC. Let's bring the guiding a little bit up for the additional length. One time enlargement is better. Yes, about the migraine, the pain from the left side completely stopped, but patient already had a history of both sides of migraine. And назад, вперед, стоп, назад. Okay. Patient had a history of both sides of migraine, that's why we decided to treat only one side, and finally patient improved from the left side. There is no migraine on the left side. Yes, this is very important. We see the spasm, and I think we should learn from experience of our colleagues, and it's very important to have less possibility of complications. During the intervention, the blood pressure could be low, and it's better to control the situation with the checking the blood pressure. Okay, scepter mini with the Chica 8 is coming. There is one branch going up, and this is the second branch going down. Okay. I think there is some kind of material from previous treatment, and we are touching it. Okay, let's leave it here. What's this? And now we will go with the about the hypotension. It's very important to avoid the hyperperfusion status, and as the lesson we learned from the colleagues, it's very important to control. It's outside. It's outside. I see. I think the tip of the hybrid is now no more workable shape. Okay. Okay. Yes, on AP it looks like we are in the ACA, but on lateral we can see we're outside of the ICA on the perforating branch. Yes, it's a choroidal artery, I think. Let's do it like this. Okay. Now it's shipping. It's a shipping technique. Okay, it looks like we are inside the branch where we wanted to go. Okay, let's leave it here. But first of all, we need to do angiography because we have been to perforating branches. Yes, everything is clear. Now let's do the angiography. I will close the syringe from the balloon, and then we can work with the hub, with the working channel. Okay. Let's do it like this, huh? Okay. There are several branches going to the territory. Минус скажешь? Минус. Okay. Плюс. It looks like everything is going to the AVM. Вперед. Виноградну. But there is no vein, huh? Okay. Just a second, I will do longer injection. There is a vein, huh? There is a vein. With this microcatheter we couldn't do coil implantation, that's why we need to bring headway duo if we need to bring some coils, huh? Okay. We can isolate this segment with the two microcatheters with the coils and balloon. Yes, this I think is more interesting. Is it possible to go to this branch? I'm not sure. Okay. There is another branch coming from the upper. Так. Бір секунд. Мынаны жоғары лақтырсаш. 1-2. Ага, и предыдущий ангел қойшы. Yes, there is another branch coming to the segment. Okay. Now we can check with the sonic. Sonic is inside the branch, but I'm not sure. It went out. Осындай бар ма еді? Мынау жаңағы ма? Бұндай ветка бар ма еді? Алдындағы предпоследний ангион родмақ қойсаш? Бұған дейін. Осын, родмақ. Smart mask. It's another something different, huh? I think it's upper territory, yeah? Okay. Let's check it. Once again. Control Enter. Callosal. Оцер. Маған тағы бір ақ шприц бересіңші. Ангиография жасау. Ақ шприц. So I asked Roman to give me the white syringe. Ақ in Kazakh language is a white. We need to check the upper territory. назад. And there is a small branch назад. Вперед. Вперед. Вперед, вперед, вперед, вперед, вперед, вперед, вперед. Just a second, let's check how much territory we can put in the ischemic risk. It's mostly parietal. Mynzhylky. Все, назад. Плюс, плюс. Вперед, вперед, вперед. Вперед. Как так? Стоп. Стоп. Too many markers, huh? Okay, now we have seen the vein, huh? The more logical to go to the vein and inject from the venous artery. It's more logical. Okay, let's leave all this stuff here. But first of all, we will try once again to go this small branch. Вперед, вперед, вперед. Okay, just a second. Okay, ülke çözüyorsunuz. Ülke. Just a second. Let's for this territory. Okay, let's put the smart mask and let's go to this branch. It's more logical. Might be logical to go there. I know the transvenous colleagues are just thinking, why not transvenous? Huh? But for me, this vein is too small, and we need to go from big highway to the small street, like in Los Angeles. From the big highway, when you go turn to the side street, then it's a beautiful places, but it needs some nice navigation, huh? You have very good navigation, then it could be okay. Okay, now we are out the let's try to go a smaller branch. Yes, might be it's accessible, but even the micro catheter 1.2 could be too big for this branch. Huh? If it will go a couple millimeters, then we may attack from this branch. Huh? Okay, I'm trying to push the sonic, but it's not so possible. Huh? The orifice is too small. Okay, let's push the balloon also. Okay. I think just a second. I hope we didn't do the mistake with the balloon. Yes, there is no mistake. It's possible to switch both syringes. Okay, I will bring balloon a little bit back and we'll do the draw to confirm we didn't rupture anything. Okay, because I did little mistake. And no, it's okay. It's very important. Okay, it's very important. When you work with the balloons, it's very important to close the balloon syringe. Yeah? Okay. I could have a heart attack. Но ветка вот не годин, да? Okay, it's possible to do 6D or 3D. Okay. Или 3D же сожжем за. 3D высушь. Let's do 3D. 3D. Брыр. Okay, let's do 3D with the mini scepter. This sonic is the smallest microcatheter, 1.2, but it's not going to the branch. Yeah? This is a beautiful branch. I'll do zoom a little bit. Okay. The story with migraine. Ана стойканы жылыстыңыздаршы. Қоды. Стойка хлопает. Венасын жылып кеткен жоқ па, қарай салыңыздар. Сәл жылытпасаңыз аяғына қарай қазір қайттан құлатамыз. Мынау сызықтан былай тұру керек. Все, болды ғой, да? Былай тұра тұрыңыз қазір. Все, жақсы. Шетке қарай тұра салыңыз. Наркозниктің артына қарай тұра салыңыз. It's not injecting through the see? It's not so good, but the idea is good, no problem. We need to castrate. Боковая проекция ХР. As we couldn't see the branch we needed, and now we need to push the okay, I need to go to the lower branch. Go to the lower branch. Последний ангел қарасаш, ана ветка қай жерден шығады екен? Осылай ғой деймін, да? Кастрация. Okay. Let's check the position of the tip of the sonic. This is not. This might be. Yes, it's at the first marker. Okay. Let's take it out. Okay, now we are in place. 3D. Боковой шахтер. Боковой шахтер. Let's check the 3D. Okay. The branches look like this, huh? It looks like there is a triangulation at the beginning. It's going this and going back. It's it's going down and then going like this. Сорок один квадрат на 7 метров. Так, направо 41. Каудальная 7. Okay. Let's do it from this projection. And now the microcatheter is not going to the branch. As the sonic is not following territory. Second. It's at the orifice, huh? It's at the orifice. And it's a wedge position. And now the venous way is maximum clear. Huh? Okay. Should we go to the venous side? Вперед. Смарт мозг. Okay. Let's do balloon assistance. No, it's not the branch with the microcatheter. I think now it's a branch with the micro. Yes. Okay, let's leave it like this. Yes, it's going backward. Huh? We can see the branch. I will inflate a little bit more. And I hope it's okay. It's a bleeding. Okay. Squid, быстро. Yes, it's sore. Narcos pogoogled this, sir. Awesome. Okay, we injected a little bit, and now I need to replace my balloon. Stitch. Awesome. Okay, that's a possible side effect, huh? Okay. Now the balloon is stuck at the orifice of the artery, and we are leaking a little bit back. Okay, just a second. Yes. There is a big hole, huh? Okay, give me Demasol. Все жүрсіз. Так, дәмсі. Ескөйт бересің.
Dexamethazen 12 salsa.
12 дексаметазон салсаңыздар.
Yeah, 12.
Some extravasation, but it's okay. And now we have a backflow from the collaterals. That's good. The territory is filling from the collaterals. Okay. It might happen, shit might happen. Okay. It's a couple cc glue, couple cc of liquid embolics. Тази написаш, кирик в колата. С който период. Okay. Okay, let's check the territory. I think we already filled all these branches, huh? This small part of corpus callosum is also healed, but I think during the transcallosal approach, our colleagues is touching the territory. I think it's time to go out with the balloon. We already occluded the territory. Okay, let's leave it here. And then I think it's upper branch. Yes, the shit might happen. And there is also some liquid embolics there. Huh? There's a liquid embolic. We'll need to take it out. We'll need a catch. Эмболизатор болду. I think during the retrieval of Sonic, it happened. There is a small piece of squid or some squid is on the bifurcation to the Callosal marginal territory. Piece of shit is here. Catch mini var hadi. Minus сколько ж? Yes, there is some piece of liquid molecule. Okay, let's take a catch mini and headway duo versation. Headway duo, güzel oldu. İmlajda catch mini деген бар. Ең астында тұрған 15. Catch mini 15. Екеуін аша беріңіз. Okay. It's a part of life, and the treatment of brain AVM is nearly. Yes, he already bled, and the risk of bleeding in brain AVM is quite high. Everybody is understanding, but we will check the neurological status after. But first of all, we need to take the small sheet from the pericallosal territory. I think the detachment point of sonic was damaged and caused this complication. Huh? Yes, I have seen many times in my life. That's why many people is scared from the treatment. But somebody should do this treatment. Так, назад, смарт мозговой переход. Стоп. Ага, осла. Smart mask. Navigate. Navigate. Roadmap. Navigate. И smart mask. Театр. Басавер. Ага. It's a part of complexity of brain AVM. That's why people are scared from the complication and send this patient for the gamma knife. And gamma knife has own complication rate, and the radiation injury is not so rare complication. Huh? Okay, now we are in the Okay. No, it's okay. Reoriented by AP view. And on an AP view, the wire is J-shaped and the microcatheter is here. Okay. One more control before we'll retrieve the doing shitty. Castrato. Pardon? келе жатыр. Айтыр. Yes, we took the headway to 156, and through the 156 now we're pushing catch mini 15 millimeter. Catch mini is 4 by something. Catch mini сыртын көрсетіп жіберсеңізші. Catch mini коробкасын. Catch mini. It's a 4 by 15. Okay. But radial force of catch mini is less than in the regular bigger size catch. Yes, and visibility of catch is a little bit less than we used to see in solitaire. That's why we should keep in mind this point, that visibility. That's its so-called pinching. Piece is out. Normal? Okay. Now it's clear. Yes. It's now with the thrombus on the tip. Huh? Уже fibrin var mı? Fibrin var mı? Yes, with the fibrin it's very important. If it comes with the fibrin, then it's more retrievable. Yes, the small piece is here.
Just that.
Yes, and the second part is here. Okay, it's like this. Okay. Вроде нормально. Okay, let's take the guiding. Okay, we don't need a venous approach. It's a good thing, but the bad thing, we had extravascular liquid embolic because of the rupture with the balloon. We did a little bit more injection because of the leaking, but it's a part of job. Okay. Вперед. Okay, the upper branch is okay, the lower branch. Вперед. As the brain is tucked by the other side. Okay. Now we will ask the anesthesiology team to bring him in a sedation till next morning. Huh? Okay, I want to just show you. There is nothing from the left side. As the left side is clear. And you can see the first video. It's an air addict day 2 in Astana. And then I think the next treatment was in March maybe. Yes. There is no AVM from here. Okay, but there is a supply. Stop. Вперед, медленно. As there is supply to the occluded territory. Okay, вперед. and there is no more draining vein. Okay, that's good. Now I will ask Rowan to do control. Control CT. Let's wait for the control. Көрейік керек болса. Қазір КТ-сын тексеріп көрейік. Зрачки одинаково. The pupils are identical. Чуть-чуть экстравазация будет. Dear colleagues, the CT is ready. Ventricle number 4 is clear. Ventricle number 3 is clear. This is a contrast blood from the extravasation, but it's not so much. It will clear. Yes, this is a contrast. It will go out till the next day, and there is not so much blood. We occluded already at the time of extravasation, and now the brain is okay. We will keep him under sedation in 1 hour and half. Келесі операциядан әкеп бір КТ түсіру керек. Астына КТ істемейді ғой? Істейді ма? Онда ровно 9:30-да бір КТ істеу керек болады. Хотя оята берсе болады. Оятып 9:30-да бір КТ жасайсыз. Yes, we'll extubate him in 1 сағат оянып үлгереді ма? Или подождать 1 сағат КТ жасап сосын ояту ғой. Okay, we'll wait 1 hour. Under general anesthesia, then we will do control CT, and if the situation will be identical to this image, then we will extubate the patient. Usually this amount of blood with contrast is not causing the problem, and patient with brain AVM usually doing better. This is a cast of liquid embolic, and now we will finish the live streaming. We have one more patient from yesterday with migraine. The pain on the left side is completely resolved, but she started to have a pain on the right side, and we will repeat the procedure on the right side. We have one more diagnostic angiography. And I wish you have a good Friday. Enjoy the Friday evening. I know in Japan it's midnight, 12:30, and in South Korea sake and soju is already on board. And happy Independence Day, United States. And see you next week, maybe during the week. Working days, we will do couple streaming We already finished budget for this month, and the next patient, collected patients will come on the beginning of August. Nice weekend. See you. Bye. Thank you.